Hello everyone, welcome to another video. So in today's video we'll be looking at another rare condition. In the last video we looked at Dupuytren's contractor. In today's video we'll be looking at another condition known as Peyronie's disease. So what exactly is this Peyronie's disease? So Peyronie disease is actually a condition that affects the penis. So it's a condition where scar tissue, also called plaque, forms inside the penis, leading to curvature, pain, and sometimes difficulty with erections. So it usually affects men, especially between the ages of 40 to 60 years, and it can cause emotional distress and problems during sexual intercourse. So this Peyronie's disease, it is not a cancer and it is not an infection, but it can affect a man's quality of life and self-esteem. So basically the penis is actually made up of 3 tubes. That is 2 corpora cavernosa, which are like erectile tissues, and 1 corpus spongiosum, which surrounds the urethra where urine and semen pass through. So each corpus cavernosum is surrounded by a strong elastic covering called the tunica albuginea. So this allows the penis to expand during an erection. So in this Peyronie's disease, the scar tissue that forms within the scar tissue forms within the tunica albuginea, that is the elastic covering. So it makes it less flexible. So during an erection, the side with the scar tissue does not stretch properly, causing the penis to like bend or curve. So what exactly causes this Peyronie's disease? So the exact cause is not fully known, but several factors may contribute, like for example, having repeated injury or trauma to the penis, which is often unnoticed during sexual activity, sports, or accidents. So besides that, having abnormal wound healing in some men, where the body produces excess scar tissue. Then also genetics, so it's hereditary, so it can run in the family, and so if it runs in the family, there's a higher chance of you getting it. So also some associated conditions that might be the cause, like some factors. So diabetes mellitus, high blood pressure, smoking, and also when someone has like connective tissue disorders like Dupuytren contractor, for example. So looking at the pathophysiology, so basically micro injuries to the tunica albuginea trigger an inflammatory response. So fibroblasts and other cells produce excess collagen, leading to plaque formation. So the plaque causes tunica albuginea to lose the elasticity, so it will not be as flexible, and during an erection the unaffected side stretches normally, while the side with the plaque stays tight, causing the penis to bend. So the bending may cause pain during erections and difficulty with sexual intercourse. So what are the signs and symptoms of this Peyronie's disease? So number 1, having a curved penis during erection. So the penis can bend either upwards, downwards, or sideways, and also pain in the penis, especially during erections too, usually in the early stages of the disease. Then having palpable lump or plaque felt under the skin of the penis, then shortening of the penis in some cases, and having erectile dysfunction, that is difficulty getting or maintaining an erection in about which is common in about 30 to 50% of cases. The emotional distress, anxiety, or depression that could be due to sexual dysfunction. So other conditions that may cause the penile curvature or pain, for example, having congenital penile curvature, which is present from birth and not necessarily due to having a scar tissue like in this case. Then also penile fracture, which is a medical emergency due to trauma during erection. Then penile cancer, which is rare and usually has other features like ulcers or certain growths. Then there's also inflammation of the glans penis, which is known as balanitis. Then there's also a skin condition affecting the penis that could cause penile pain, which is known as lichen sclerosus. So all these other conditions, they can also cause penile curvature and penile pain. So for the treatment depends on the severity and where the condition is, and whether the condition is stable or is progressing. So some non-surgical options, these are the options that the doctor would refer to in cases of where the condition is not so serious, like in mild cases or in the early stage of the disease. So first, the doctor will actually observe the patient to check if the curvature is mild and to check if it's not worsening. Then some oral medications could be given, although these oral medications are just like supportive. So there's not really much information about like it's benefiting the condition, like treating it basically. So for example, like vitamin E, which is an antioxidant that may reduce inflammation. Then there's a medication known as potassium para-aminobenzoate, which may slow the plaque formation. Then pentoxifylline, which improves blood flow, that may help to soften the plaque. Then injection therapy is usually more effective than the oral treatments. So having an enzyme injection, like we talked about in Dupuytren's contractor, so having an enzyme injection that breaks down the scar tissue. Then steroid injections too. So the particular enzyme injection that is used both in Peyronie's disease and in Dupuytren's contractor is known as collagenase Clostridium histolyticum. So this enzyme injection is used in the two cases. Then steroid injections to reduce the inflammation, which is given in early stages of the disease. So for severe cases or long-standing cases, we often advise for surgical treatments. So some of the surgical procedures, there's one that is known as Nesbit's procedure. So it involves removing or pinching tissue on the opposite side of the plaque to straighten the penis. Then there's also plaque incision and grafting. That's another procedure which involves cutting the plaque and placing a patch or a graft. Then there's also penile prosthesis, which is like an implant. So for men with severe erectile dysfunction and curvature, this is done for those particular type of men. So for the management, so in this case of this condition where the exact cause is not known, so like management, just like lifestyle modifications. So if you are a smoker, stop smoking, limit alcohol, manage other coexisting conditions like diabetes and hypertension. And healthcare professionals, is good that they encourage males to seek medical help if they experience penile pain or curvature, especially men in the age range of 40 to 60. So if they experience pain, curvature, or oval lumps, they should go and get it checked. and they should reassure patients that early treatment may help to improve the symptoms, and also explain that this Peyronie's disease is actually not cancerous, and is not contagious. Then also monitor for progression. So usually some cases stabilize without the need for surgery, so surgery is usually like the last resort where the condition is very severe. So in summary, this Peyronie's disease is a condition where the scar tissue forms in the penis, causing curvature, pain, and sometimes erectile dysfunction. So it is more common in middle-aged men, 40 to 60, and it often results from injury and abnormal healing. And then treatment options range from observation to medications, injections, enzyme injections, steroid injections, or surgery, depending on the severity. So it's good that patients are educated about this kind of conditions, so it will be better so that we know how to support them in managing the psychological effects, the emotional effects, and everything combined. So thank you for watching this video. See you in the next video. Bye.